Did you ever wonder why smallpox, a disease that killed millions, is no longer a threat today? This question takes us deep into the annals of human history where we confront a deadly adversary, smallpox. It was a ruthless killer that spared no one, causing devastation on a scale that's hard to fathom in today's world. Smallpox was a silent enemy that instilled fear in societies around the globe. It was an unpredictable monster, striking swiftly and mercilessly. Its high mortality rate made it a grim reaper in its own right. Imagine living in a time when a simple rash could signal the end. That was the reality of smallpox. It was a time when survival felt like a game of chance, a deadly gamble against an invisible foe. But how did we overcome this deadly disease? To understand this, we need to take a journey back in time. Our journey begins in ancient Egypt, where the earliest evidence of smallpox was found. Here in the land of pyramids and pharaohs, we see the first signs of this deadly disease etched into the skin of a mummified child, dated back to the 3rd millennium BCE. From these ancient beginnings, smallpox would go on to shape the course of history. Fast forward to 5th century BCE, it was believed to be the culprit behind the Plague of Athens, a devastating epidemic that shook the cradle of Western civilization, claiming thousands of lives. The disease reared its ugly head again during the 2nd century CE in what is known as the Antonine Plague. This outbreak, believed to be a severe form of smallpox, swept across the Roman Empire, causing widespread devastation and contributing to its eventual decline. But smallpox was not content to stay within the confines of the Old World. As the European explorers embarked on their voyages of discovery, they unwittingly brought this deadly passenger with them. The disease spread like wildfire through the Americas, decimating indigenous populations who had no natural immunity against it. However, amidst this grim narrative, there was a beacon of hope. In the late 18th century, a British physician named Edward Jenner made a groundbreaking discovery. He observed that milkmaids who contracted cowpox, a disease similar to smallpox, seemed to be immune to the deadly smallpox virus. This observation led Jenner to develop the world's first vaccine in 1796. He named it Vaccinia, derived from the Latin word for cow, vacca. This vaccine, a shot of hope in an otherwise bleak landscape, marked the beginning of a new chapter in the fight against smallpox. This was a pivotal moment in medical history, offering a glimmer of hope in the face of a disease that had claimed countless lives. With the advent of the vaccine, the battle against smallpox began to turn in our favor, but was this enough to eradicate the disease? The world had a weapon against smallpox, but the war was far from over. With the smallpox vaccine at their disposal, humanity wasn't going down without a fight. The year was 1967, and the World Health Organization launched an ambitious project known as the Intensified Smallpox Eradication Program. This was no small task. The disease had been a constant threat for centuries, leaving behind a trail of devastation. Yet, the world was ready to face this challenge head-on. The program aimed at universal immunization, targeting even the most remote corners of the globe. Disease surveillance was ramped up, with healthcare workers diligently tracking smallpox cases to ensure timely vaccination and containment. The journey was fraught with obstacles. There were logistical problems, cultural barriers, and the sheer scale of the task was overwhelming. But the world was relentless. We adapted, innovated, and persevered. Strategies were tailored to suit different regions and communities. Mobile teams were dispatched to reach the most inaccessible areas, and ring vaccination was used to control outbreaks, immunizing all potential contacts of a diagnosed patient. The effort was colossal, the commitment unwavering. And finally, the day arrived that humanity had been striving for. In 1980, after centuries of devastation, the World Health Organization declared smallpox eradicated. The last known natural case was in 1977, and since then, no cases of smallpox have been reported. But what does this mean for us today? Today, smallpox is the only human disease that has been eradicated. This monumental feat has left a significant imprint on the scientific community and public health landscape. The eradication of smallpox stands as a beacon of hope, a testament to human ingenuity, and a blueprint for tackling other global health challenges. The strategies and lessons gleaned from this victory are being actively applied to current and future health initiatives. So while smallpox may be a thing of the past, its legacy continues to shape our world.